We will now do a practice drill of the nail wrap section of the Maryland State Board exam. Make sure when you're doing this section you use a tweezer and the backing of the sticker of the wrap or some kind of other material, plastic material, to apply the wrap. Do not use your fingers. For the nail wrap, make sure you do not come with it already pre-cut. You have to cut it at the State Board during the exam. So for the nail wrap section, you'll have 14 tasks, 25 minutes. You'll be observed and scored on safety, sanitation, infection control, application of the nail wrap, filing, and appearance of the finished nail. You will apply a nail wrap to the nail tip you have just finished. You will not polish the nail wrap. You will demonstrate cutting the wrap to fit the nail, which will be attached. Pre-cut wraps are not permitted. Here are some tips for taking the Maryland State Board Nail Technology exam. You can use these tips for all the sections of the exam. Always wear your goggles when you're using any type of the chemicals. So for the acrylics, the tips, and the wraps, you should always have goggles on. Keep your kit closed at all times. It's an automatic failure if your kit is open. Sanitize your hand before going into your kit. Label all the bags and items. Keep all bags and items closed. The monomer must be odorless, and it must be a new bottle for the test. Use tweezers to take things out of the bags or to take out a disinfectant. Throw all files away. New files must be used for each section, and keep your new files in your bag of supplies and materials for each section, and throw them out after each section. Keep your area and your table clean and neat at all times. Make sure you disinfect your table and sanitize your hands before and after each section. Safety and sanitation is always the most important. All implements must be disinfected at all times. If you're not using it, do not leave them on the station. Wipe down before putting back in the disinfectant. Sanitize your hands and your client's hands before you start. Sanitize and disinfect the table before and after each section. Thank you.